In the year 2025, patients are actively looking past the pharmacy counter, searching for natural ways to manage their health. This shift is often driven by a specific frustration: the compound side effects that can accumulate after years of using synthetic pharmaceuticals. Many are turning to homeopathy. This system is built on treating the whole person, using non-toxic remedies that aim to stimulate the body's own healing processes at the root. However, looking for guidance online often leads to a polarized debate. The conversation is frequently framed as a tribal war between scientific medicine and natural healing. Treating this as a philosophical side to join is risky. It can lead patients to ignore effective medical tools simply because they don't fit a specific ideology. The dilemma for most patients is practical. How do you actually evaluate these two different systems for your own specific ailment? Choosing the wrong system for a condition has a clear impact on your recovery timeline. To compare them, we have to look at the pace and target of each approach. If you are facing an acute medical crisis that is moving quickly, relying on slow, holistic methods can lead to a physical emergency. But for a lifelong chronic issue, relying solely on harsh synthetic treatments may lead to a cycle of managing one side effect with another drug. There is no single best system. Effective healthcare requires matching the medical tool to the urgency and severity of the condition you're actually facing. We can map this choice using a decision tree. If your immediate physical condition falls into the acute category, like physical trauma, surgery, or severe infections, the path requires speed. These situations demand allopathic intervention, using synthetic drugs to provide a fast physiological response. The strength of this system is its ability to provide life-saving intervention and immediate stabilization when time is the most critical factor. The trade-off is that while allopathy stops the immediate crisis, it often addresses symptoms rather than underlying causes. Long-term use can lead to toxicity. For conditions developing over years, we move down the chronic branch. This includes lifestyle diseases like diabetes, recurring allergies, and mental health concerns where the goal is long-term balance. Homeopathy addresses these with personalized, non-toxic remedies matching the individual's constitution. The primary benefit is the ability to manage these conditions over time without the cumulative side effects often associated with long-term pharmaceutical use. However, this is a slow process that requires patience. Homeopathy is not equipped for and is dangerous to use in immediate medical emergencies. Many patients now look toward an integrative approach, utilizing both systems based on bodily needs. Allopathic drugs act as a temporary emergency brake for acute flare-ups, while homeopathic remedies work in the background to build baseline wellness and reduce those flare-ups. For example, someone might use conventional medicine to stabilize a severe arthritis flare-up, while using homeopathy to address the underlying inflammation over several months. This requires total transparency. Your conventional doctor and homeopath must communicate to ensure natural remedies and synthetic drugs don't interfere with one another. It also requires more from the patient. Managing two different protocols takes more time and often carries a higher financial cost. Despite those logistics, integration provides a comprehensive safety net. It offers the tools to survive an acute crisis and the tools to thrive long-term. To help you decide, we can plot these needs on a quadrant chart. We look at how fast you need relief versus the nature of the condition itself. If you are an urgent responder, you're dealing with things like broken bones, intense pain, or a severe infection. In this quadrant, allopathy is necessary. The urgent need for stabilization makes it the only tool capable of responding within the required timeframe. If you are a long-term optimizer, you're managing stable chronic issues or looking to strengthen your immune system. Homeopathy aligns with this profile's goals, offering a way to manage health over a longer timeline without the burden of synthetic side effects. Knowing where your specific health concern lands on this grid is a necessary step before you book your next consultation. Let the body's timeline, rather than a preference for one philosophy, dictate which medical tools you use. The 2025 strategy is to use allopathy as the emergency brake for disaster and homeopathy as the maintenance plan for long-term health. You must consult with licensed healthcare specialists before you stop or change any active treatment protocol. Many modern clinics are now prepared to help patients navigate these integrative plans if they are requested. Optimized healthcare isn't about winning a debate. It's about using the smartest combination of tools to ensure your body is both stable today and healthy years from now.